Okay, I'm gonna go ahead and give a brief introduction for our speaker. Dr. Kevin Kloesel has many hats. Director of Oklahoma Climate Survey, professor at the University of Oklahoma, College of Atmospheric and Geographic Sciences, which has been renamed since I was there. What else? Oh yeah, the University Meteorologist for OU, Office of Emergency Management. All kinds of things. Very, very brilliant person, great speaker, has always really interesting talks and classes. And so I am personally very excited that you're speaking this evening for our chapter. And with that, I will go ahead and pass it off to you.
Amanda, you're very, very kind. In fact, we've changed since, just a few months ago. We've had a lot of reorganization at the University of Oklahoma. And so the Office of Emergency Preparedness and Emergency Management is now all the Department of Campus Safety. So we're in the process of reorganization, not only at the college level, but at the university level. But bottom line is we have an administration at our place that is very, very safety conscious. And that makes my job incredibly easy. And so I can't say that any of the things that you see this evening don't happen without leadership on our campus at the highest levels across not only administration, but OU athletics, marching band, spirit, you name it. There is very much a safety conscious attitude with our leadership. And again, it makes my job incredibly easy because I don't have to convince anybody on our campus of anything. They know it, they get it. And they give us the latitude to do what we do, and they place the trust in us that maybe other universities haven't quite understood yet. And that's kind of where I fit. I'm on this crusade now of kind of going to other universities and making presentations and trying to make sure that it's across the board, right? It's typically weather safety on a college campus is either about tornadoes or it's about athletics. And the problem with that is that we have on our campus over 300 events that take place every single year that are non-athletics. It's donor functions, it's statue dedication, scholarship things, student organizations, you name it. And so we have events literally every single day. And of course, as you know, right, October's been a little busy from a standpoint of severe weather, and it looks like we're going to get busy again tomorrow evening. And so it's kind of interesting that we're also seeing an understanding on our campus that meteorology is important and weather safety is important, not just in May, not just in football season, but pretty much any time of year. And so I've had the opportunity to do a lot of different things with this hat. This is a hat that I sort of put on myself in 2014 after about 7 years of trying to convince leadership that it was something that might be necessary on our campus, and have had the opportunity to kind of take off with it. This kind of got started with me just by way of introduction. This was a poster that I presented at an AMS annual meeting several years ago. And it was kind of funny the way this happened because I had the most unusual looking poster in the AMS poster hall. And a lot of people did double takes because, of course, the first thing they saw was, the Yankee logo or the Red Sox logo. And then you hear all the whispering and the murmuring from students that, wait a minute, it's okay to do something like that, at an AMS conference. How can that be, true foundational meteorology? And after I got the opportunity to explain to a lot of people that, my goal growing up as a Little League baseball player was to make it to the Baseball Hall of Fame. I had hoped to make it as a player, but that didn't turn out that way. But in the midst of doing this presentation on a stampede in Yankee Stadium in May of 1929, and this is the Gehrig and Ruth Yankees, where fatalities occurred at Yankee Stadium because of a refusal to call the game in the midst of highly visible, weather threats. And then you end up with a large-scale derecho, severe weather, hail, gusty winds, and a stampede to exit the stadium. And in that stampede, 2 were killed, dozens were injured. And the injuries look a lot like the Mayfest. These are life-altering injuries: cracked skulls, broken backs, paralysis, broken arms, compound fractures. And then, of course, the two people that were killed are our most vulnerable populations, one very young, one very old. And it occurred to me that, we haven't learned much at our venues, with our athletics, with our marching bands, with anybody who are, doing activities outside in large groups. And a marching band certainly qualifies. We're not talking about thousands per se, but if you're up at Allen High School, not far from your weather service office, you are talking about hundreds of kids that are outside and dealing with the elements. And this one thing led to another. And I ended up getting the opportunity to present this at the National Baseball Hall of Fame, and now the data and the poster reside in the library. So I finally bucket list my goal. I finally made it to the National Baseball Hall of Fame. Wasn't quite the way I had hoped as a player, but it turns out that this sort of set the path for a number of AMS and now Event Safety Alliance related things, and also now working with leadership at the National Weather Association on some initiatives. And finally, for the first time in AMS history, you can go back and look at AMS presentations and panel discussions. I was able to bring together at an AMS conference a panel of folks that really weren't AMS people, other than, you see Nate Johnson's on that list and Eric Bruning's on that list. But April Messerly is with the University of West Virginia, works for the NCAA. Joe Abernathy, St. Louis Cardinals. Jim Forster, the PGA. Steve Edelman, a lawyer. And really were able to bring together a multidisciplinary group to do a 2-hour packed session at AMS Phoenix, talking about the needs of outdoor activities, outdoor venues of our community, right? Not just us publishing in journals, but where do we need to put our information? And of course, it starts with the fatalities, man. And we're guilty of this in Norman, right? In Norman, nobody wants to come to the National Weather Center, be a student to study heat or drizzle or fog, and all those things that give you heartache from a standpoint of weather-related car accidents, for example. But over and over and over again, we see heat as the high end in terms of weather fatalities. Almost doesn't matter what year you pick, heat's going to be near or at the top of the list, both in the average and in the annual statistics. And in many of these other weather categories, you can add them all up and combine them, and they don't come to the number of fatalities that we see in heat. The same is true in high school and college athletics. We spend a ton of time with lightning and a ton of time trying to come up with lightning mitigation strategies and 8-mile radii and clearing stadiums and things like that. But it turns out, if you look at the actual data, only 1% of the high school and college football fatalities are lightning. You see the typical ones you hear, right? Cardiac and head injury, that's over 60%. But the very next thing on that list is heat. And there was scant little being done in this area. And it's why you continue to see, for example, football players dying of heat illness, most recently at the University of Maryland a couple of years ago, but at the high school level, most recently is 2 months ago in the state of Georgia, where another high school kid was killed in high school football practice during the first week of the season due to heat. It happens every single year. I show this because within the realm of climate and climate change, there's a lot being published on heat wave characteristics, heat wave frequency, heat wave season length. And I just wanted to put this here as a put it in the back of your mind that if we've got heat issues now, you haven't seen anything yet. And if we don't learn how to mitigate against heat illness now, we're going to find ourselves with a category of weather-related fatalities that's going to continue to go up, partly because we've been so focused on other areas: lightning, tornadoes, hurricanes, floods, you name it. Not that those aren't important, but they're not the top of the list. And if we truly are going to make a difference, I believe it is in the area of heat where we can make the most difference. Because you can look at tornado and hurricane and flood fatalities, and not all of those are preventable. But you can look at heat fatalities, and almost every single one of them is preventable. So the ability to really lower the weather impacts and the fatality statistics, I think, is a focus on heat. And this is that same data in terms of heat frequency, heat wave severity, against some of the projections just for Texas, and looking at the fact that even with deep cuts in emissions, climate change research downscaled to state level would indicate that you're still likely to have a doubling of heat-related deaths, even in the best case scenario. And of course, if you're looking at no cuts in emissions, now you're talking about heat illness that is an annual killer in the state of Texas. And it's something, again, that we have to put our emergency management hats on and really work toward preparedness. So this is kind of the trailer or the prequel of where this comes from. I started working with our band in 2014, started working with an ensemble cast of characters from all over the place. I have to give Brian Britt a ton of credit. He is the director of the Pride of Oklahoma. The fact that our band takes weather seriously, you look no farther than the Drumskins. Our Drumskins are a constant reminder that safety is primary. And you'll see this if you watch any football game or whatever the case may be. This is an example of one of our Drumskins, which is a reminder to our band that weather needs to be taken seriously. And of course, lightning is much more visual on a Drumskin than heat. So we chose lightning there. But you'll see a couple of folks, Matthew Smith, the director of the Marching Jayhawks, Jay Jacobs, who is the director of the Mighty Sound of the Southeast, which is the band at the University of South Carolina, Dan Atchison, who is Drum Corps International, Stuart Pompel, Pacific Crest, Jim Olay, who is a health and wellness caption head, but a EMT in Chicago, Laura Van Doren from Central Texas. She's a Cedar Park mom and is also the lead for what is now the Marching Music Health, Wellness, and Safety Program, which we founded a couple of years ago. And then two athletic trainers that I cannot do this without, Don Emerson and Tony Torres McGehee. And we have been working constantly on trying to get actionable information and planning into the hands of marching band directors all over the place, whether this is the NCAA or junior colleges or high schools, whatever the case may be. And this is kind of where it starts, right? Every band has this image or a whatever symbol, a similar one in their emergency plans. And what we've noticed is across the board, heat index is in fact the most popular metric of choice to trigger heat mitigation activities. There's just one problem with it. It's not correlated with heat illness. If you look at heat statistics and emergency room visits from just about any metropolitan area, any rural area, etc., what you're going to find out is that heat index and heat emergency room visits or heat 911 calls, whatever they are not correlated. As the heat index goes up, you actually see a maximum in heat calls, typically with heat index values in the 85 to 89 range. Now, there is not a single, and this is not poking at the weather service, but it's just the way we've been conditioned to think about heat, right? This real feel value, having a number that's larger than the heat because we think it's going to make people take action because, it feels like it's 105 out today rather than, 98 or whatever the case may be. And real feel and trying to get people to do heat awareness is fantastic. But the decision makers need data that is actionable and relevant. If you take these exact same heat calls and you plot them against wet bulb globe temperature, they look like this. That's a heat metric I want to use because what it suggests is that as this value goes up, so do heat visits and 911 calls to emergency rooms. The other thing that's kind of fascinating about this is that particularly at these lower values of wet bulb globe temperature, you see a higher value the day before, which might suggest that there is a cumulative effect of meteorological conditions in a heat illness case rather than the instantaneous values on the day of. But in this particular case, as you can imagine, it's incredibly difficult to communicate because you're telling people, oh, by the way, if this particular index gets to 80 or 85 or 90, you need to have heat mitigation strategies or heat prevention strategies in place, because that's where we're seeing the 911 calls. And of course, when you say 85, when you say 90, that's not something that people take seriously, particularly in Texas, right? You tell somebody, you know, there's a wet bulb globe temperature or index of 90, they're going to be like, yeah, whatever, right? That's not hot. You know, 100 is hot. And this happens all the time, right? That triple digit mental block that 100 is hot, but 99 isn't. This is prevalent in why we have so many heat fatalities, is because we're getting the fatalities before we ever reach those threshold values that we typically see for Weather Service issuance of heat index. Now, why is wet bulb globe temperature apparently more highly correlated with heat illness? It turns out that it's because it takes into account more of the factors that are related to heat illness than the heat index can capture, right? The heat index is two metrics, temperature and moisture, and measured in the shade. It's from a shelter. Wet bulb globe temperature takes into account radiation. It uses temperature, humidity, wind speed, sun angle, cloud cover, all of the things that you know inherently cause you to feel hot, right? Walking outside on a summer day, the heat index is not relevant if you're working on a roof, or if you're working in a parking lot, or if you've got heavy clothing on, or whatever the case may be. Heat index cannot capture all of the impacts. This is, again, Austin. I've been working with them and working with the Austin San Antonio office of the Weather Service, and Aaron and Paul and John Zeitler and all the amazing folks that are down there. But here's the bad news, right? This was in 2018, 490 heat-related hospital visits in Austin. 72% of those visits are from males. If you've seen lightning statistics, the heat statistics look just like the lightning statistics. It is a male stupidity dominated fatality rate. And it just bugs the heck out of me to see these numbers. You know, age group, same kind of thing that we sometimes see with lightning, sort of that 30 to 39. The thing that's interesting about these 490 heat-related hospital visits is that these were across an entire year, right? From April all the way into the fall, and only 2 heat advisories were in effect on the days that you had the heat calls. And that's crazy for me to think about all the heat advisories that were issued by that office that year, and to have literally null cases on most of them. Now, you could argue and say, oh no, we put the heat advisory out and therefore people didn't go outside. That's not true. We can go back and look at festival days, you know, that just as many people are outside, football days, etc. Home football games for UT Austin, those kinds of things where you have the same number of people outside that you would have otherwise. But there's something really unique about wet bulb globe temperature and that lack of wind combined with sunshine to go with high temperature and high humidity that's different than if you have the exact same temperature and moisture characteristics, but with say a gusty south breeze, for example. The simple metrics that we've used are not working, and this is what happens. This is Austin Independent School District using for their athletes and for their band kids and everything else, the heat index chart. And it even says exposure to full sunshine can increase the values. Yes, that's great. But strong winds, particularly very hot, dry air, can be extremely hazardous. That's just not true. Wind is a cooling effect, whether it is in the winter or in the summer. Wind does not stop being a cooling effect just because it's in July or August. That doesn't happen. It aids in evaporation. Now, do you need to be hydrated? Yes, absolutely. It can increase the evaporation. So you'd have to be hydrated, but it's also a significant cooling effect at that same time. And wind is not hazardous in these situations. So even the content for our schools is incorrect as it pertains to heat mitigation strategies. And this is, again, it's a labor of love at this point, literally going door to door to school districts to try and help them correct these issues. If you remember that chart, this is the AISD guidelines. Temperature has to reach 100 and the heat index has to reach 110 before any mitigation strategies occur with athletics, fine arts, or PE and recess. That can't happen. And it's why we see so many heat calls in school age groups, particularly early in the semester, August, September. And these are not zero numbers, right? We have so many football and band kids being transported. And Greg, I think it was you earlier that we were having the conversation talking about when you were, you had your children who were in band, and we're seeing this everywhere. It's not just Texas, it's across the entirety of the nation, right? It's not just Texas. We see things like this, right? Member of the Pride of the Southland Band collapses during halftime performance. It was about 90 degrees at the time of the performance. Man, 90 degrees scares the daylights out of me, because as it turns out, most of the fatalities that occur in heat occur with a air temperature right around 90. It's very much in that range. And in this particular case, if you go back and look at the data suggests the heat index was about 92, but you had high temperatures, high humidity, sunshine, and literally no breeze, right? The actual outside wind direction at the nearest station, ASOS station, was 4 miles per hour. That's it. And inside Neyland Stadium, which is completely bold, there's none, right? That's calm conditions inside. And these are the conditions that add to the temperature and the humidity that can cause heat illness in these situations. It seemingly makes sense to me that we're looking very much at the uniforms associated with marching bands as one of the primary culprits. If you look back at Tennessee, that's an August 31st, and they're in their full uniforms, which is very tradition. The Shako hats with the plume. Just a horrible, horrible decision on behalf of the students made by the adults in this particular case. And that's a preventable illness right there. That one's preventable. What somebody did in the name of tradition and everything else actually put that young man on the ground because of the decisions that were made. And this is another problem that we have with bands all over the country. For example, the Spirit of Troy, USC. Many people are familiar with this iconic band and their iconic uniforms, right? Tradition. And in 1998, they had multiple Spirit of Troy band members collapsed heat exhaustion during the game after refusing to take off their jackets and be out of uniform. Because again, tradition here, right, is part of the behavioral piece that needs to be overcome. These uniforms are very, very similar to the kinds of things that the Roman troops wore back in 24 BC. And if anybody has ever sort of learned about the fall of the Roman Empire and what role climate conditions and heat played in the fall of that empire, they literally had their army wiped out on an expedition to Arabia in 24 BC because of similar conditions. And you can go back and kind of recreate what the patterns might have looked like and what even the wet bulb globe temperature might have looked like at that time during that march to Arabia that literally wiped out any ability of the Romans to defend themselves. They had overstretched their ability to hydrate their army, and they didn't understand the importance of uniforms. You name it, right? It's everywhere. It's Minnesota, it's West Virginia, it's Texas, it's Oklahoma, it's Carolina, it's parades, it's competitions, it's football games, it's rehearsals. All of these articles are just in the last 4 years, and there are hundreds more. We just published an article in the Journal for Athletic Training, and there's another one coming that tries to quantify this heat issue in marching band. September 18th, this was before the pandemic started. I saw this past my news feed. Several students in Madisonville rushed to hospital for heat exhaustion. Come on, it's a Saturday, it's late September, and several students in you know what this is, right? It's a Saturday. It's like, okay, I knew it. I could bet the ranch it's banned. It's got to be banned. And in this particular case, it was. According to officials with the Madisonville Fire Department, the students were participating in a band competition at Madisonville High School. It's unclear if the students were from Madisonville or a school participating. And now there's evaluating students who appear to be ill, and they've stopped the competition. This was a pretty high heat index day, 98. And what was surprising to me looking at the weather information is that the winds were also fairly high, 13 out of the southeast during the middle part of the day. That's not a wind speed we typically see heat index at a band competition, unless there's another factor. And that other factor that we've seen time and time again is, I guess Madisonville has a field turf surface. And sure enough, that is the case. This surface is the scourge of any student who plays football or is in marching band in the August-September timeframe, because this is nothing but plastic with black rubber pellets. And schools have gone to this surface time and time again to eliminate the need to pay for water to irrigate grass. But this particular surface gets incredibly hot. And then it means that the local wet bulb globe conditions are not representative to the nearest ASOS, AWOS, or weather station that you might have somewhere else, right? You need to actually measure the wet bulb globe temperature on site in a situation like this to get the true impact of heat on a performer, because these particular surfaces, and this study was done in Utah of all places, the outside temperature ranged from 83 to 100 at these various high schools. This was in July. But look at the football field turf temperatures. Oh my goodness, right? We're talking about anything from 146 up to almost 180, even in situations where the ambient air temperature was 83 or 84 degrees. This is a picture I took. This was at Katy ISD down in Houston with a wet bulb globe thermometer and an infrared thermometer of the conditions on the field, which were simply just too hot for a performance. And so we ended up delaying the performance until it cooled down because we didn't want those kids on the field. This particular stuff, and people now are asking all the time, it's kind of awesome, right? It's like, well, Kevin, what do we do to mitigate this? And I said, well, water it. And they're like, well, gee, Kevin, we got this field so we wouldn't have to water it. And I'm like, I know, but if you want to cool it down appropriately, water it. And they're like, well, when do we water it? I said, well, you need to water it about an hour before, because otherwise it'll evaporate away. Well, we'd like to water it the day before. No, you can't water it the day before, because then you lose the cooling from the evaporation. And so you literally have to water it right before a performance or a game. Here are the high school heat fatalities over the last 20 years, and the average maximum air temperature on the day of the heat fatality was about 90. The heat index was typically below 100, but light winds, which again gives some credence to using wet bulb globe, core body temperature averaged 107.8. All deaths in the study occurred during July, August, and September. Most of them occurred in rehearsals and practices rather than on game day. And 60% occurred in athletes wearing uniforms or helmets. This is also football, shakos, you name it. So again, focusing on the attire and what you do in rehearsals and practices is absolutely key for a decision maker, and they can make life-saving decisions. So this is our band, and you'll notice that none of them have an instrument. They're not holding the instrument. The instrument they carry around them for them in their marching drills is their water cooler. We have a wet bulb globe device on site. We've actually moved this rehearsal to later in the evening. You can see the long shadows. So we have completely revamped how the Pride of Oklahoma does rehearsals. We do some acclimation in uniform so that they can get used to the heat, but for short periods of time. And we always have ice kiddie pools, right? These, for a high school that worries about, oh my gosh, Kevin, we can't afford it. I'm like, let me go to the dollar store and I'll buy it for you, right? All you need are some kiddie pools and bags of ice and water, because in a heat situation, the faster you can get the body temperature down, the survivability of that heat illness or heat stress goes way up. And you can't sit around and wait for EMTs to get there from a 911 call. So have something available on site in case somebody's body temperature gets too high. You can immediately get their body temperature down. And so this is what we've done with the Pride of Oklahoma, is we're monitoring constantly. We always have our kiddie pools out there if the conditions are such that we're suspecting the possibility of heat index or heat illness. And now what we've done is we have gone so far as to take the wet bulb globe temperature and create guidance for marching bands based upon hydration, work, rest protocols. And man, do the band directors hate this with a passion, right? To tell their band that they have to rest for 6 minutes per hour or 9 minutes per hour or 12 or even 15 minutes per hour, you think it's the worst thing that ever happened to them. But one of the things that we've been able to educate many of the band directors that are using this is that your band is going to perform far more efficiently in their rehearsal if they are alert, if they are rested, if they are hydrated. And if you just keep pushing, then your repetitions are going to be awful and you're just going to get more and more frustrated. It wasn't until our band directors started seeing the results of this and putting this into place, at least around here, and then in the Drum Corps International world, that we started getting some positive feedback that, yeah, that's probably the best thing that could have happened. So I am on the Marching Music Health Wellness Committee and serve as the meteorologist on that committee. We now have heat mitigation strategies in every member handbook for every corps in Drum Corps International. We're working to try and do this with university marching bands at this point, and whatever high school bands will listen to us at this point in time. We've had success with places like Broken Arrow, which is great because they're very popular in the Bands of America circuit, in the competition circuit. And when other directors ask our Broken Arrow band director, well, God, your kids look so fresh. Why, how do you do that? And he says, well, here's how, right? We do this for heat. We use wet bulb globe temperature. We do work rest modification. We do mandatory hydration, shaded breaks, you name it. And when we started putting this in place with Pacific Crest Drum Corps, they got a lot of publicity. And the cool thing about Pacific Crest is in the Drum Corps competition world, Pacific Crest never finished higher than about 20th or 25th. The 1 year I got to work with them, and I still do, this was in 2019, was the first year I worked with the director and I said, you just trust me, right? Just trust me. We're going to do it this way. We're going to do it this way as part of a research project. And here's what I need from you. I was doing daily analysis of weather situations wherever they were. They were doing on-site wet bulb globe temperature. That's the lower picture is me in the midst of that corps at a very early morning rehearsal to stay out of the heat of the day. And this corps finished 12th for the first time in their history, finishing lower or higher in this case than 20th. And they have now used this strategy over and over again. And now suddenly other drum corps are calling. I'm working now with Phantom Regiment, Blue Stars, Blue Coats, Blue Devils, Santa Clara Vanguard, the Troopers, you name it. And every single one of them now gets to finals at the end of the season, much more fresh and with far fewer heat illness situations than they ever have before. And part of it is that we need to do a better job. Man, I hate putting up equations, but if you think about the atmosphere and you think about the budget equations, whether it's the radiation budget, the thermodynamic energy budget, you name it, trying to balance our dynamical equations, it's no different for a person, right? unless we have a heat illness metric that is a body heat budget, we're never going to get there, right? Heat index doesn't cut it, right? It doesn't really convey anything associated with the body's ability to store heat or release heat or cool or warm or any of that. You need to know more things about the individual, and that's where it gets really, really complicated. So what it means is that it's not just the atmospheric variables that are important. You also need to know something about domain variables, right? Where are these folks? Like I mentioned earlier, the field turf field, and individual variables. How much have they had to drink? Is it alcohol? How much have they had to eat? Their rest. And most importantly, what medication are they on? So this is Luke. Luke is a color guard individual in band. Luke, before rehearsal, decides to drink blue milk. And then when he gets to rehearsal, he has a heat illness stress situation. Now, the question is, can we take Luke's heat illness and just relate it to air temperature, humidity, radiation, wind speed? That answer is no. Could it have been those things combined with the stadium, the field surface, field turf? Was it very dry, etc.? Possibly. Could it have been Luke's outfit? I mean, check out what Luke is wearing, right? This is heavy wool, long sleeve, and probably not good for an August rehearsal. Did Luke have his appropriate nutrition, hydration? Is Luke on ADHD medication? Is he on medication for depression? And you can likely think of these other factors, or was it that darn blue milk, right? Is it the blue milk that caused his body temperature to spike in maybe ways that we weren't aware, and that participated? And you have to think about all of those things. So that's what we did. We took the South Carolina Arnold School of Public Health, the Department of Health, Sport, and Exercise Science at the University of Kansas, our own Department of Campus Safety, and we started working with every individual band member on our 3 campuses, and we did everything imaginable. And our IRB people were busy. We queried the presence of known heat illness risk factors. We did it based upon primary instrument to see if there were differences across percussion, brass, winds, color guard. We identified them through a variety of medical history, 24-hour surveys of food intake and hydration, sleep quantity. Did they feel well? We did an eating disorder inventory. Anything that we could think of back with that equation of all the things that can cause body temperature to go up or down, any imaginable thing we could come up with within the literature, we tried to measure. And then we deployed atmospheric sensors. And the one thing that we were good about our 3 bands is all 3 of our bands work on a grass field. So we were able to kind of take the actual domain factors out of this and hold those at 0. And then compare across the bands and compare across medical, compare across health, compare across weather. And these are the preliminary findings that are about to be published in the Journal of Atmospheric I keep saying Journal of Atmospheric. You can tell I'm the meteorologist in the bunch. The Journal of Athletic Training. I keep making that mistake. I apologize. Any safety metric has to have all of these. It turns out that 13% of band members surveyed indicate daily use of psychosocial pharmaceuticals, and the ones that they're using actually have known impacts on core body temperature and also promote dehydration. Can already somebody showing up with an elevated core body temperature, a low-grade fever perhaps, can that impact heat illness? Oh my gosh, yes, right? They get to heat illness a whole lot faster than the student who's not on psychosocial. If you combine that with dehydration, same thing, which means that high resolution atmospheric monitoring is also going to be important, because we have to figure out how the conditions of wind and those things relate to that particular individual, because 34% of them self-reported symptoms of heat stress. The majority of those, when we went back and looked at when they reported it, were in low wind speed, high sun environments. Again, the highest wet bulb globe temperature environments, not necessarily the highest heat index environments. And then this one, I didn't really make it a big point when I showed you the Austin data, but if you noticed, the day before the heat call seemingly always had a higher heat index and or a higher wet bulb globe temperature than on the day of. And we're seeing this, right? We're seeing that there is some cumulative effect, and maybe we relate this to something like cooling degree days or heating degree days, some concept like that with heat index or heat illness, sorry. Heat illness doesn't necessarily occur when the instantaneous value of heat index or wet bulb globe temperature is high, but after a period of cumulative wet bulb globe temperature conditions, not even so much heat index, because as you've already seen, it's not really correlated. But this ramp up of heat and maybe the inability of the body to completely cool itself from rehearsal on day 1, rehearsal on day 2, makes you more susceptible to heat potentially on day 3. And we're seeing day 2 and day 3 in these heat waves are the big days where we're getting more and more heat calls rather than the first instance of sort of the instantaneous heat on a certain afternoon. So here's what we're going to do next. And this was something we wanted to do in 2021, but because of COVID, we didn't do it. But we're going to take the Pacific Crest core that we've been working with, and we are going to give them ingestible thermistors. And we're going to do core body temperature measuring every 15 minutes during rehearsals. We're going to do skin temperature measurements using sensors on chest, arm, thigh, and calf. We're doing heart rate and activity metrics continuously using wrist-worn devices. We will be doing weight and urine specific gravity pre and post rehearsal to determine percent body mass loss, so dehydration, measuring fluid volume consumption during all activity, and then continuous monitoring of the atmospheric and domain variables. We want to populate as many terms in that heat budget equation for the human as we possibly can, because if we know how their body temperature is going up and down, it gives us a fighting chance to be able to figure out what are the things that we need to most mitigate against, or at least look after. And so here's the idea. The idea is to take algorithms that would incorporate the atmospheric domain and individual factors, put it into a wrist-worn device to achieve a personalized advisory of exertional heat illness for the individual, based upon whether they're hydrated or not, based upon whether they're on medication or not, based upon their nutrition over the last 24 hours, and the atmospheric conditions and the domain conditions, so that Luke could be told in this case, he looks kind of haggard now because he's been drinking that blue milk. He needs to drink the green milk instead, right? The actual wrist-worn device would be tied to an action, and the action would notify the individual that, hey, you need to take a rest, or you need to have water, or you need to do something, right? You need to take some sort of mitigation or prevention action to help you. And it's not one size fits all. It's not one heat index that applies to the whole band. It's not even one wet bulb globe temperature that applies to the whole band. It's a wet bulb globe temperature that applies to an individual who has different situational influences than the person next to them. Or maybe it takes the brass section or the percussion section, and because they're brass or percussion, it's different than if it's color guard or something like that. We have states who are so far ahead in this regard than either Oklahoma or Texas. And I'm just thrilled to see that Governor Murphy in New Jersey signed legislation to implement some of the wet bulb globe temperature index and activity charts that we had been working on. And they are actually tying them to actions and requiring each school district to purchase wet bulb globe temperature devices to be at each game and practice site. This is a huge leap forward in prevention of heat illness, particularly at the high school level with band and football. Donna Howard, representative from Austin, tried to do this past session with House Bill 2876. It never made it out of committee. And that has redoubled my efforts to work with Representative Howard on how this bill can be rewritten, because unfortunately it was very specific on the use of wet bulb globe, but very vague on actions and determinants that would help a coach or a band director. And because of that vagueness, it never made it out of committee. But I don't know if any of you know Donna Howard, but she's got a bachelor's degree in nursing, master's in health education. She was a critical care nurse. And she really is, I mean, she's passionate about the health issue. So any partnering that we can do between the meteorology realm and the health realm, I'm hopeful that maybe next session in Texas, we might be able to get something done. From a Weather Service perspective, my goodness gracious, thank you for the Weather Service for starting this transition to wet bulb globe temperature and inclusion of wet bulb globe temperature forecast information in the grids. This is going to be one of the biggest steps toward helping a band director, a football coach, an athletic trainer mitigate against heat illness and start planning for practice and rehearsals the next day and the next day, because they'll be able to see the cumulative impacts. And if we can help with the education, the ability for the Weather Service to provide this information through grids, I think is going to be really a giant step forward in helping us to mitigate or at least lessen the number of heat fatalities that we see in these age groups. So kudos to the National Weather Service for starting this process down the wet bulb globe temperature road and making sure that that information is in the grids. In addition, I'm working with DCI on an online weather safety curriculum for the marching arts, which the National Federation for High School is then going to make mandatory for band directors. They would take modules in all of these areas, right? Weather hazards, planning, safe strategies, decision-making and return to play, communications, contingencies, travel, drills and staff training, first aid, you name it. We're hoping to have these modules done by sometime in early 2023 so that it can be a course that all of those band directors take and become certified for, and hopefully that also translates into fewer heat illness cases. With that, we've done everything we possibly can and then some at the University of Oklahoma, to the point now where we're involving our mascots in our public relations and public information heat safety campaigns. I have to thank OU Spirit for their involvement as well. They've been phenomenal, but again, like I mentioned at the very beginning, could not do this without the assistance of leadership at the University of Oklahoma, the leadership at the Pride of Oklahoma, OU Athletics, through all the way to the athletic director, OU Spirit, the mascots. It makes my job so much easier. And with that, I am going to stop sharing my screen. I'm happy to take questions, Amanda.
Awesome. Well, I have a couple, but I will open it up to everyone else first. Thank you so much. That was a great presentation. Lots of really interesting information.
I do have a question. It's Greg again. I'm in awe. Thank you for what you're doing. I wish you'd been around years before. You've addressed so many issues. Are y'all going to take the next step and address the types of hydration as sports drink versus water?
Yes, absolutely. And there are times for both of those, right? There are times for sports drinks. Those are typically between rehearsals when you're trying to recharge, not during rehearsals. We're trying to focus on water during rehearsals, and then sort of the hopefully the G0s. We're also looking at sort of the sugary substance drinks and how those weigh into this as well. But we're right now during rehearsals and practices always focusing on water and water only.
Thank you again, sir.
You bet.
Here, I'll jump in. Dr. Kloesel, it's good to see you again.
Hey,
This was a very fascinating talk, and interesting to see the work that you've done with a very specific group of people and the target audience. And I had an initial question, but you addressed part of it at the very end, where you were saying that you were now seeing the wet bulb temperature um, grids in the National Weather Service. So, to follow up with that, are you aware of or helping with changes that might be made with the National Weather Service issuance of heat-related products to better help the general public?
yeah, there's several people that are kind of on a task force, and it's actually being led by some folks at Arizona State University. And the Weather Service is part of that team. It's not being led by the Weather Service. It's actually being led by Arizona State and the Corey Stringer Institute at UConn. And that's an assessment team that I have been on for about 2 years now, where we are looking at everything from accessibility of the information, reliability of the information. Like, for example, if I use a Mesonet site for wet bulb globe temperature, but it's on a field turf field, that's not going to be relevant, right? So the ability for individuals to locally measure their own wet bulb globe temperature, I think, is going to be hugely important given the domain factors.
Yes, I agree with that, and hopefully, with whatever techniques they have with nationally available gridded data, and who knows, maybe something with machine learning, that you can at least have a general sense of what those conditions might be, and then apply it to those heat warnings or heat advisories, where you bring that threshold back down to something where you won't have the number of hospitalizations or illnesses. So I'm glad that work is going on. So thank you for that information.
My question is actually very similar to Steve's also, is since you work closely with Austin San Antonio, EWX, did they change any of their criteria for advisories and warnings and whatnot related to heat as a result of the work that was done?
So what you will see both from EWX and from OUN right now is that in these situations, and you guys all know Randy Bowers, and Randy I have learned more meteorology from Randy than I've learned from all of my meteorology instructors combined. And I mean, he's just phenomenal. He's working with the office, and Aaron Treadway at EWX is working with their office, where you'll see in their AFDs, they're still using kind of heat index as the primary, but in their AFDs, there will be a paragraph discussion that, for example, we may see, we may need to be worried about heat today at this particular, location or these particular counties because of sunshine, low wind speeds, whatever the case may be. You're not really seeing it officially in terms of how the heat advisory is issued, but you're seeing the underlying how the sausage is made in the AFD, where there is a paragraph talking about wet bulb globe temperature. Now, what we then do on our end is we make sure that emergency managers and those people, particularly with school systems, school emergency managers, who unfortunately, that's typically the largest school districts, right, that have those kind of people, but pay attention to the AFD. We have our Norman athletic director, so Norman Public Schools athletic director. I send him something every one of these particular days. So, we're trying to help them directly with information and how we would, want them to think about mitigation strategies during the course of a day. And we've had that discussion because they have a field turf surface as well. We moved a couple of games early in the season to 8:30 p.m. So that it was after the sun went down, and that solved a number of things, right? It allowed the field turf temperature to come way down, and because of the lack of sunshine, it allowed the wet bulb globe temperature to come way down. And so we were seeing, I mean, how many of you have ever been to a high school football game? They're hard to watch in late August and early September, because by the time you get to the middle of the third quarter, some poor kid has cramps on every play, right? These games last for 4 hours because every play in the second half, a kid comes up with cramps. And it's like, all right, we got to fix that, right? And so trying to fix that through, better practice regimen, better mitigation strategies, but even the in-game situations where we might be able to modify start times and things like that can all be used. So it's, that's a long answer to your question, but officially, no. Unofficially, and in AFD discussions, yes, you're starting to see it. And I'm hopeful that we can finally get heat index out of the vocabulary. I already tell my students that if I catch them using the word heat index, I'm fining them $1. So, and Amanda, well, the that's $1 crusade. So
yes. Well, I will definitely share it with Fort Worth's management team, because I think it's really important, and it's something that we've had discussions about as far as the different criteria and trying to make it as applicable and accurate as possible. So yeah, this is really interesting stuff.
Well, let me tell you a quick frustration, Amanda. Sorry to interrupt you, but I was trying to get the same 911 he called information from Dallas and Fort Worth, and I was told it's not available.
All right.
That they don't keep those. They list it as some other code, and it's a generic code, and you can't extract what's heat and what's not out of the EMT call codes. It's just that there was an EMT call, and that's because they decided that was apparently too much private information or whatever the case may be. Same thing is true in tornadoes and other things. It's really tough to get accurate data from health departments associated with this issue. We were able to get it from Austin. We were able to get it from San Antonio. We were able to get it from Oklahoma. We were not able to get it from Dallas and Fort Worth.
My other question is, with all the extensive work with relation to marching bands and all of those activities, are you going to in the future spread that into specifically into the football realm, which I know in Texas and Oklahoma and other places, that's probably a little harder door to get in, because even my own personal experience, my son's a freshman in high school and tried to play football this year. He unfortunately broke 2 of his legs, so he couldn't, but
oh no.
I know. But it's very closed off as far, even to the parents. So I was just curious how that was going, if that's an avenue you guys are going to take or not.
So 2018 was my first visit with David Jackson of the Oklahoma Secondary Schools Athletic Association. So we're now 3 years in. I have volunteered. I have given them presentations. I have even gone to some of the school safety personnel at the state level, and the state level said, OSSAA is their own thing, right? We can't tell them what to do unless they want to do it. And I'm 0 for 4 years now with trying to get them to change. And so, yes, the football and the athletic community at the high school level is horrifyingly difficult. I will say that we had similar problems when Bob Stoops was here, right? He was not very receptive. I would put him on a 0 to 10 scale of 0 being the most receptive and 10 being the most obstinate. He was probably an 11. Lincoln Riley is a big old 0, right? He has taken everything we've told him and done it. And, it's kind of funny, because if you look at their second halves, they're kicking people's tail in the second halves of games. Mm-hmm. And I think there may be a reason for that. Right now, I will say that we did get a game ball one week because of our work, but it's been a whole lot easier to do it at our own university level than it has been to do it in the high school level. So what we're going to do next is Lincoln at next summer's coaches clinic is going to have us come in, and he's going to introduce it to the high school coaches at the coaches clinic and have us, talk for 15 minutes with the coaches about how we do things at the University of Oklahoma, with backed up with the stats about how much fresher in the fourth quarter and, those kinds of things. So he's our conduit into the Oklahoma high schools. and hopefully that'll work out. And we're looking forward to doing that.
Showing that there's improvement in the latter half of the game, I'm sure is probably going to speak volumes. Good luck.
Yeah, that's, again, you cannot do this with high school. Well, you can't do it with football coaches unless you can tie it to results, right? Everything is results driven. Same with marching band, right? Same thing. The competition integrity of, for example, Drum Corps International, people were stunned when we got to finals in Indianapolis and Pacific Crest was kicking tail. And they were like, what in the world happened to this corps? And their director said, talk to Kevin. And I'm like, yeah. So, yeah, the non-music guy, right?
Are there any other questions? Hearing none, thanks again for the presentation and for all the work you've done on this and what's going forward. It's great stuff.
Yeah, we're looking forward to this next summer when we can actually get, here's the issue with the ingestible thermistors. We're going to have a lot of people signing waivers.
Oh, I'm sure.
So.
And I'll be very curious to hear how it goes with the next session in Texas. And if there's anything that I can do to help, feel free to let me know.
Absolutely, definitely. I appreciate the invitation, Amanda. Thank you so much. I enjoyed this.
Yes, thank you. I'm glad it finally came to fruition.
Yeah, sorry about last month with
it's okay.
But I think you guys were working storms that night too.
Yes, we were. Yes, we were. Well, I hope you have a good evening.
Thank you.
Have any chapter business to pass along to everyone other than if you haven't paid your dues, send them in. And yeah, whenever you get a chance, Kevin, send me the address so we can send you the thank you gift for this evening. And,
well, that's very kind of you. I will do that right now.
Unless any of the other chapter officers have anything, I don't have anything else to share for the meeting.
Kevin, if you're interested, did you get any information out of Fort Worth that you're talking about for heat injuries?
No. I was unsuccessful with the Tarrant County Health people.
I have a contact. If you'll stick around, I'll get some information to you.
Oh, yeah, that would be amazing. Would love that.
It'd be nice to be able to pull it all the way up the interstate.
Yep.
All right, well, if there's nothing else, the rest of everybody can drop off, and I hope you have a good evening, and we will see you on the second Tuesday of December.